Now scanning the right upper part of the abdomen, and patient is lying in spine position. Here we see the left lobe of liver, which is normal and shows normal texture. This is gallbladder, which contain anaerobic fluid. And here we see a well-defined echogenic lesion, which resembles to stone. The gallbladder is partially filled and the walls appears to be normal. Now rotating the patient at left lumbar side, placing a probe at mid-clavicular line to scan the gallbladder. This lesion resembles to stone, but the shadows are not present. Now we will see the origin of this lesion. Here we see the lesion is arising from the anterior wall of the gallbladder. On color Doppler, we see no flow in this region. Now we will measure the size of this lesion. The size of this lesion is 5.8 into 6.2 millimeter. Now how we will write report.